I'm Don Diefenbacher, Mountain Valley Hospice, CEO and President.
What does Mountain Valley Hospice do?
We go out and really, our goal is to enhance the life of somebody with a terminal illness and to help them maybe reach some goals in their final days of life. And we're really all about the patient and the family. We provide care 24/7, RN care, home health aid services, spiritual care, when a loved one passes, bereavement and grief counseling. So a very wide range of services, including volunteers and social work as well.
How does a family contact or become involved with hospice when a patient reaches the point that they need you?
Well, anyone can call us. Typically, a patient may be referred to us by their primary care physician, or their primary care physician says, hey, maybe it's time to contact the people at Mountain Valley Hospice. Nothing more than picking up the phone and giving us a ring at 518-725-4545.
There are no income requirements or any of that?
No, absolutely not. Medicare and Medicaid pay just about everything for the care we provide, and so do most insurances. So typically there's no out-of-pocket money for our services at all.
That's a difficult time of life, but a big part of life is the exit, and it's hard on the families and hard, I'm sure, on the patients. How about the caregivers?
Boy, that's a great question. We don't see that question or hear that question. Mainly, it's always been about the patient and their concerns, but our caregivers give their utmost all in their hearts to many of the patients, all of the patients that we see, and in many cases they become friends of those patients. And it's very difficult when the patient passes. They take that to heart, and we actually have to we support our staff through some grievance counseling and grief counseling as well. So, very good question.
You mentioned there are volunteer opportunities with Mountain Valley Hospice. What are those about?
Well, typically a volunteer can volunteer in our house, for example. We have a residence. They can come in and perform cooking and maybe cleanings, those kinds of things. Often they'll be out in a patient's home and they can give the primary caregiver a break for those day-to-day things, such as the caregiver may need an hour just to go out and grocery shop or go out and have a physician visit their own or whatever it happens to be. So it's really just a value for a volunteer to come in and be able to give that primary caregiver some comfort. And also they do things like run for prescriptions and whatever the family happens to need that isn't related to specifically taking care of the patient. They're more than willing to help out.
What is the age range for your volunteers?
Great question again. Typically, we're seeing them in the maybe early 40s to we have some are in their 70s actually. The typical volunteer tends to come to us because they've had some kind of patient may have come to us in the past or have experienced hospice through either us or through another local hospice or even nationally. So it typically, there's a reason they come to volunteer, and it's typically because it feels good to them and because they've had experience somewhere along the way with caring for a patient or a loved one.
The event today, what's this about?
The event is today. It's our memorial walk. It's an opportunity for families to come out and support their loved one that has passed, whether through formation of a team, and it's an opportunity for them to put pictures up on a memorial wall to remember, and it's also an opportunity for those families to interact with our staff as well, and it's good for friends and families and our staff to be able to get together and reunite, because as you say, it was a very difficult time when a family member is going through providing care for a loved one who's passed, and just support is really the bottom line, is just to support each other.
And one more time, could you repeat the contact information if people are interested?
Sure, it's Mountain Valley Hospice, 518-725-4545. Just give us a ring and we'll get back to you.